Welcome to this series in health profession education related to social accountability. The main purpose of medical education is to improve the population health. And it will not be possible to improve the population health unless we redirect the education, service, and research toward addressing the community health priorities. I am Mohamed Hassan Taha. I am Assistant Professor of Medical Education, Director of Medical Education Center at the University of Sharjah, and interested in the area of social accountability in health profession education. In this series of videos, we will be talking about social accountability in health profession education, and the main aim of this session is to advance the concept, to explain the know-how of implementing social accountability by educational institutes. This series of videos also will cover how to support the educational institute to assess their compliance with the concept and values of social accountability. And we'll share with you practical tools to integrate or to instill social accountability in the curriculum, how to develop faculty development programs in advancing social accountability, and finally we'll end up with leadership for advancing social accountability. I encourage you to watch this series of videos because they are closely integrated with each other, and understanding some concepts related to videos, a specific video in this series of videos will be closely related to the other series of videos. Let us start this series of videos, and we will start with the progress of social accountability concepts. And before talking to social accountability, we'll talk about community-oriented medical education and community-based education. Our today video will be about the concept of community-based and community-oriented medical education. We'll talk about the concept and we'll talk about the importance. We'll clarify some misconceptions related to the concepts. So why community-based or focused education is important? Health and illness are shaped beyond the hospitals. And what we see as practitioners, as a clinician, in the hospital is the iceberg of the disease. Social, economic, and environmental factors drive the outcome of the disease, and definitely the social determinant of health, which is non-medical determinant of health, represent a major issue in health and illness. And medical schools must prepare graduates for real context, not only for the training in the hospital. And we are observing and facing many limitations in the existing or the traditional curricula, as most of them are hospital-centric learning environment. They focus on disease with minimum engagement with prevention, very weak link with the population data. And the educational consequence here, the graduates, they produce graduates who are skills in treatment, but limited skills in prevention and advocacy of the health. I highly encourage you to read this AMI guide about the integrating social determinants of health into medical curriculum, because this guide will shed the light on the importance of this social determinant of health and how do these determinants impact our health and what are the solutions that need to be considered in order to integrate it in the curriculum at the level of the planning, delivery, assessment, and overall evaluation of the curriculum. Let's go back to our session. And The main aim of this session is to define the community, community-oriented and community-based education, as well as surface learning approach, and to discuss the advantage of both approach. Most of the slides presented here and the information presented here actually is the great work of our leader, the guru of community-based medical education and community-oriented medical education, our teacher, Professor Bashir Hamid, who has developed this concept early and who established one of the most important community-oriented medical school in the Emro region, University of Jazeera, Faculty of Medicine. And I am a graduate from this university, so most of the experience that I will be sharing related to community-oriented and community-based medical education, it will include some personal experience with this innovative approach in teaching and learning and in medical education. Before I start the session related to community-oriented and community-based education, let us define what do we mean by the community. Community is a group of individuals and families living together in a defined geographical area. This area could be a village, town, or a city. It's not necessarily to be a rural area. And community-oriented medical education is the approach. It is a philosophy to medical or health professional education. And it is education focused on the population group and individuals, taking into account the health needs of this community. It might be defined by relevant medical education. So because relevant to the community needs, which take into consideration the priority outcomes or the priority health outcomes of the community, and take into consideration all the aspects of its operations, the priority of the problem in the country or the region. And it is a philosophy, as Professor Bashir Hamid mentioned, in which educational priorities, outcomes, structure are derived from analysis of the priority community health needs and aligned with the population health and equity goal. So for this reason, in order to have a community-oriented medical education, co-creation approach should be considered. And co-creation here, community as a partner should have a great input in the development of the curriculum. So why community-oriented medical education? The aim here is to produce community-oriented doctors and healthcare professionals who are both able and willing to serve their communities and deal effectively with health problems at primary, secondary, and tertiary level. There is a misconception about community-oriented medical education. The aim here is not to produce community medicine specialists or new category of health personnel, but to respond primarily to the needs of the community concerned. For example, if we have a surgeon rather than focusing his role in the operating tables or before operation assessment and after operation care, he should have the role of being anticipating in reducing or doing some sort of health advocacy to prevent the occurrence of some problems that could be some serious problems that could be prevented. So these very important things that need to be considered. And so what is expected of community-oriented doctor? Whatever the practice, the specialty, including research, these doctors will be characterized by their community-oriented approach. And what do you mean by community-oriented approach? For example, surgeons, including orthopedic surgeons or neurosurgeons, for example, they would ask themselves about the road traffic accidents. Why it is common in the community? They are practicing. what can they do to reduce the incidence of road traffic accidents, how they can collaborate with the stakeholder to work on this. Another example for internal medicine, a, diabetes, a diabetologist working in the community where the prevalence of diabetes is high need to think about ways of promotive and preventive measures to reducing or delaying the incidence of the diabetes. Maybe awareness, health campaigns, podcast, or whatever the measure that could be. So the products here is to the community-oriented medical education is to serve the purpose of health-oriented physician rather than disease-oriented. So because if we work for the health, we will prevent disease. So this is very important thing that we need to consider in community-oriented and community-based education. Let's move to community-based education. Community-based education is a form. Community-oriented medical education is a philosophy or approach, while community-based medical education is a form of instructions where trainees learn professional competence in the community setting, focusing on population group and the individual and the everyday problem. And during the training here in the community, students learn about the social and economic aspects of illness, about health services in the community and the methods of the promotion, about working in team, about frequency and type of problems encountered outside the hospital setting. So it is educational strategies in which community settings are used as a primary learning environment to enable experiential learning service and reflection on real population health problem. And during the training in the community, students learn about the social aspects, about any issues related to community, about the social determinant of health. So it can be conducted anywhere where the people live, in rural, sub-rural, urban, and many areas of organized. So it is a way or instructional approach, instructional methods in which students learn within the community. Some people confuse community-based education with the surface learning. Let us define surface learning. Surface learning, on the other hand, it is educational approach that integrate a meaningful surface with learning objective. So providing surface with learning objective. And here, reflection is the key. So integration the surface in community-based education, community could learn without doing surface. But here they are providing surface. And learning is enhanced through a reflection. And the benefit here is mutual for the student as well as for the community. So the core component of the surface learning is that reflection is the key. They have to identify and justify the need for the surface. This is related to investigation. We have four closely interrelated with each other. We start with investigation, then designing and planning, or designing and preparation, then taking action, then reflection. So reflection is the key in surface learning. In investigating, we start with identifying and justifying the need for the surface, evaluate and extending existing action, identify personal skills and goals, and then discuss the ethical issues while learning. For designing and preparing, establishing partnership, determining the success criteria, develop action plan, organize the resource. For taking action, collaborate effectively with others, demonstrate intercultural understanding through action, preserve through action and demonstrate commitment. For reflecting and communicating, evaluate the impact of the surface, evaluate of the surface on the recipient, evaluate the impact of the surface on you as a learner, suggest realistic improvement to the surface, present your learning as a learner in a wider audience, and this is related to the reflection. So reflection is integral part in surface learning, and again, provision of service as well as the learning. And learning is basically related to social determinant of health, and it's a very important topic that we need to consider and to instill in our curriculum. So why social determinants of health are important and educational issue? Health inequalities persist despite of clinical advances. Now we have advances with the AIs and with advances in education and the service, but still there are many health inequalities. Clinical training alone cannot address the root cause of the problem. So we need to go deep and analyze this problem. Education must prepare graduate to recognize and respond to the context. Therefore, social determinant of health integration in the curriculum is the responsibility for us as educators. Let us take another example. We'll take the same example as diabetes. The biomedical framing of the diabetes is diagnosis and pharmacotherapy. But the social determinant of health framing, including the food system, the lifestyle, the education, the awareness, and so on. And the education implication here, assessment and teaching must include the context when teaching students with diabetes. So community-based education and community-oriented medical education should be a partner, not only site for training. So communities are co-educators. We need to see the community in the curriculum planning committee, in the evaluation of the colleagues, in teaching the students. And learning must be mutually beneficial for the community as well for our students. And ethical engagement here is mandatory because we have social obligation toward our community. And this reframes the power of medical education today, because with advancement in medical education today, we are still facing many challenges and so on. As a graduate from community-oriented medical education, along with my colleague, we managed to study the impact of community-based medical education on the graduate performance on this published article, which is available online, with my colleague, Mohamed Hassan Abdullah, Wain Nouri, and Mohamed Sanosi. He was a professor and chancellor of the University of Jazeera. Wain Nouri was the dean, Faculty of Medicine, University of Jazeera, and Mohamed Hassan Abdullah was the deputy director of the Educational Development Center, University of Jazeera also. All we were a graduate from this university, and we studied the impact of the community-oriented and community-based medical education on graduate performance using qualitative study, using critical incidence approach. We send link through which study participants can record experience and incidents related to community-based educations, and most of the incidents were related to the rural area training, interdisciplinary research field training program, and home visit medicine, family medicine. They reported that this approach, community-based medical education, had great impact at undergraduate level in enhancing the leadership skills, the patient-centered care, the professional behavior, the personal development, and the sense of belonging to the community. While when they graduate from the college, this approach supports them to improve the quality of patient care, strengths health system practice, contribution to the curriculum development in their organizations and their colleagues. And I can reflect on that. I'm medical educators with the passion of advancing the population health through medical education, and I am working in the area of social accountability. And what motivates me to work in this area is being a graduate of or a product of this approach, community-based medical education from Faculty of Medicine, University of Jazeera. Also, lifelong learning and improvement skills and enhance family practice. So, if this is enough, community-oriented and community-based medical education, we have explored community-oriented medical education as a curriculum philosophy, community-based medical education as pedagogy, and social determinant of health as a framework, so that it can be considered. I want to ask a critical question here. Is understanding context is sufficient for educational responsibility? And this will shift us to the social accountability. Uh, we will be discussing social accountability in the rest of the videos in this series. So the key shift from knowing the health inequalities to responding to them, and from contextual awareness to institutional responsibility, and this shift marks the move toward social accountability. The take-home message from this video, community-oriented medical education provides the purpose, and community-based education provides the pedagogy, and together they support medical education toward being relevant to the community need. Thank you so much for watching this video, and I highly encourage you to watch the rest of the videos in this series related to social accountability for better understanding of the concept and how to move the concept forward and how to enhance the medical education in a way that can enhance or support the population health, and let us work together for impact on the population health. See you in the next video.